Our last speakers are Allison, Corrado, and Rebecca Naker joining us from Minnesota. The Blue Cross and Blue Shield of Minnesota Foundation is a trailblazing leader in efforts to address health disparities in Minnesota and build healthier communities. They've taken a strategic approach to addressing the drivers of health inequity by establishing strong relationships with community partners. One of their primary programs focuses on improving access to high-quality early childhood education, programming, and training across the state. In her role as Senior Program Officer at the Foundation, Allison leads their Healthy Start early childhood efforts. She's been with the Foundation for more than 5 years and is a passionate leader in their partnerships to advance health equity. Allison is joined today by one of their Healthy Start grantee partners, City of St. Paul 3K, represented here today by Councilmember Rebecca Naker. Councilmember Naker is deeply invested in creating opportunities for young people and is leading a team working to expand access to high-quality pre-K in St. Paul. Thank you both for being with us today, and I'll turn it over to Allison to get started.
Hi, good afternoon. I'm going to start with just a little bit of information about who we are at the Blue Cross Foundation. We are a statewide corporate health equity funder. A few years ago in the strategic planning process, we embedded health equity into the center of our mission statement. So you'll see it there on the screen that we make a healthy difference in communities by advancing health equity and improving conditions where people live, learn, work, and play. In the health realm, we talk about the social determinants of health, and that's what we're referring to there. We at the Blue Cross Foundation are both a separate and a highly interconnected organization with Blue Cross and Blue Shield of Minnesota, our statewide insurance provider, and we make grants to nonprofits across the state of Minnesota. That's our approach, is investing in communities. We have about $60 million in assets, and that is dedicated exclusively to improving community health across Minnesota. And what that looks like in a year-to-year, we, in 2018, made about $3 million in grants to organizations. So we're a fairly small funder. All of the work that we do is grounded in much of the research that you've heard about in the earlier presenters of this webinar. We know that health happens in the community. When we look at all of the things that influence our health outcomes, 40% of those are these social and economic factors. These are things outside of a clinical environment and often things that people lack control over. Although we know that despite what we know, health spending does not reflect what actually influences our health. So of the about $9 trillion that we spend as a nation on health, about 95% of that goes to direct medical care services. Only about 5% is allocated to population-wide approaches to health improvement. So we're backwards in lining up our funding for what we know really matters for our health. Here at the Foundation, we focus on 3 different programs, and I'll talk briefly about 2 of them and then dig in deeper into our Healthy Start portfolio, which is our early childhood education work. The first is Healthy Connections, where we're working to create and build and improve on safety and feelings of welcoming in communities around the state. We know that when people feel safe and welcomed, they can experience better health outcomes, things like lower blood pressure and stronger immune systems. A second body of work around access to coverage, working towards universal insurance coverage across the state of Minnesota. We know that uninsured people are far more likely than those with insurance to delay health care or to go without it entirely. And we know that these effects can be really devastating, particularly when things are preventable or life-threatening conditions are left untreated. And then the body of work that I lead up is called Healthy Start. We know that what you've heard all of these things so far today, but what happens in the first 5 years of life sets the stage for lifelong health. This is our key driver. Children who participate in these high-quality early childhood programs experience a range of both immediate and long-term health outcomes. So our approach to health in this Healthy Start portfolio is really long-term. We're looking at the immediate, but we're looking at also some of the research that was already discussed, that 30 years down the line when these little ones are adults, they're healthier. Within Healthy Start, our goal is to make a healthy difference in communities by advancing health equity in early childhood care and education by focusing in on communities that lack access to high-quality early childhood care and education for reasons that are really beyond their individual control. And we fund organizations that are working at the intersection of health equity, which we define as a state where all people can reach their highest level of health, high-quality early childhood care and education for 0 to 5-year-olds, and systems change, where we talk about intentionally changing parts of systems and structures and policies, as well as things like power and mindset and infrastructure to advance health equity. And organizations that we support must create or contribute to systems change and move beyond providing direct services. What that looks like on the ground is for our funding, we're currently funding 10 nonprofit organizations around the state that are all focused on increasing access and improving the quality of early childhood care and education. We know that there's just not enough childcare in the state of Minnesota. All but I think 2 counties in the state have a significant childcare shortage. But as you've heard over and over again in this webinar, the quality really matters. We're not interested in creating new childcare that is poor quality and isn't going to support young children in the way that we want it to. These organizations range from really large regional operations across the state to really small grassroots organizations or even fiscally sponsored projects, as you'll hear from when Rebecca talks a little bit about her work. We are clear with our incoming goals related to access and quality and what we want to see changing and the trajectory. But how the work gets done is very up to the individual organization and what works in their community. We do a lot of work up front when we're deciding who to fund, to intentionally fund organizations that are constituent-led and are meaningfully engaged with the communities that they anticipate will benefit from the work that we do. And we think that that's a really key strategy for our funding, is to really get as close to the people that are affected by the problem through the organizations that we fund. So we know that the approaches that they'll use will all be different, but they'll all be designed in mind of the people that will benefit from them. And examples of this work include supporting child care programs, to participate in our state's quality rating and improvement system. In Minnesota, it's called Parent Aware. Things like coaching to child care providers, creating social emotional curriculum, and training licensed family child care providers to really use and adopt this social emotional focus in their programs. And in a minute, you'll hear a little bit more from our grantee partner about their work and how they're building this quality early childhood program using this private-public partnership model, really to expand access to all low-income kids in our capital city, St. Paul, here in Minnesota. We track all of the work that we're using an evaluation framework, and we're seeing that what we're doing is having a huge impact in the communities that our grantees are in. Results from a first evaluation checkpoint indicate significant progress towards goals. Things like over 600 new child care slots have been created, 1,000 child care providers have been trained in quality programming. There's been over 4,000 hours of technical assistance and coaching provided, 27 new licensed child care providers, and 90 providers receiving a parent-aware rating. So fairly small numbers in the scheme of things when you look across the country, but in Minnesota, these numbers are huge. And we also keep our eye on community-level indicators and think about how the outcomes our grantees are achieving really contribute to this larger picture. So contribute, I think, being the key word here. We know that our funding alone is not going to directly move these community level indicators at a substantial level. What we're doing is contributing to a larger change, and I think that that's really fantastic. So ideally, a statewide indicator on something like kindergarten readiness would be fantastic. In Minnesota, we don't have that. That would be, we would consider that a strong proxy measure for educational success. But unfortunately, we don't have that statewide. So some of the community level indicators that we use are tracking statewide data on childcare shortages and using our state's quality rating and improvement system to track participation for programs around the state and looking at where there are gaps and opportunities to provide a little additional support through our philanthropic funding and how we're moving forward. And with that, I want to pass it over to Rebecca to talk a little bit about the specifics of what she's doing in St. Paul.